So now I'm going to invite two folks locally who've come tonight, Sean Edwards and Michelle Olson from Indivisible Somerville and Minuteman Indivisible, to talk about some of the work they did to set their vision and determine their organizing goal in recent campaigns. So please help me welcome Michelle and Sean. We're going to get them mic'd up. So if you could do just a quick introduction of who you are and the groups you're with and your most recent campaign that you took on.
Sure. So my name's Sean Edwards. I'm an organizer for Indivisible Somerville, and I really wanted to talk about the Affordable Care Act and the back and forth that's been happening and continues to happen over that issue.
Great. Thank you.
I'm Michelle Olson with Minutemen Indivisible out in Lexington. We've been working on lots of issues, but the healthcare has certainly been top of the agenda over the course of the last few months.
Great. So back us up a little bit. Everyone has heard healthcare debate in the public media, but how did you come to that as a problem, individually and then as organizations? How did you come to that problem, and talk us through some of your process?
So I think for our organization, for Indivisible Somerville, we believe that that people should have health care, and we viewed this fight as essentially the effort to take people's health care away, and so that that I think was a fight worth fighting for.
Okay. How about for you?
Yeah, when Indivisible formed at the beginning of January, right after the election, many of our members came with healthcare at the top of the agenda for them personally. They felt a personal threat to their healthcare, and many of our members felt that healthcare was a fundamental human right and that universal access to safe, affordable care was on the top of their priority list for a healthy society.
Great. So what I want to reflect back is you both said something big, which was you were setting a big vision. Universal healthcare is a human right, and your organizations wanted to spend time advancing that cause. But, dun dun dun, there was a problem, right? That's the context in which we actually establish our campaigns. Can you tell me what the problem was? Why was there healthcare at risk?
Sure. Well, back in 2010, there was the Affordable Health Care Act passed, and that established health care for a large segment of the population. And with the incoming new administration as well as Congress, there was talk of repealing the Affordable Care Act, which would have put under threat health care to roughly 20 to 24 million Americans and made it much less affordable for many more than that.
Yeah. So there was an imminent threat. At what level of government?
The federal level.
Okay.
Mm-hmm.
Yeah. And it would impact healthcare for millions of people.
Millions.
Yep. You heard all of this in the news. So what did you choose to do? What was the solution you offered?
So, at first, what we chose to do was to ask our representatives to oppose the bill, and being in Massachusetts, they said, well, of course. And so we went to them and said, no, but really, please. And they said, yeah, we're working on it. And so, at that point, we were kind of like, okay, well, what do we do now? If our representatives are actually on our side on this issue, and showing up in their offices is actually just taking their staff's time when they could be fighting for this issue, what do we do from there?
Yeah. So what did you decide to do? Where did you decide to focus your efforts?
Well, after 17 thank you notes to Elizabeth Warren and a few posters and rallies, we moved on and said, well, who are the decision makers? Who really holds the decision to this? It's not Elizabeth Warren or Catherine Clark, our congressperson, but it's those who are sitting on the fence. So we said, well, how can we get to them?
Yeah. And you're going to hear in a little bit who those people were and what activities these folks engaged in. But let's actually map out what we heard. They said universal health care is a right for all people, and that's currently under attack. Not that everyone had access to healthcare, but there was a big piece of legislation that passed that expanded healthcare to millions. And that was at risk of being overturned by the current administration, right? Problem, context. Solution is, let's keep the healthcare that we got and then we can build some more, right? And so they took on the congressional healthcare fight. What were some other potential solutions you considered to try and increase access to universal healthcare as a universal right for everyone? What were the other potential solutions that your organizations talked about?
So we talked about expanding Medicare for all. We talked about different I guess policy initiatives that I think would have been a substitute for the ACA that I think that my group at least would have been open to supporting. In terms of defending the ACA, we talked about social media campaigns and advocating to people in the districts of the people that we wanted to persuade. I think that stood out pretty quickly to us as a vector that we wanted to pursue of let's find the people who are actually represented by the people we want to persuade and connect with them.
Great. Michelle?
Yeah, well, we also thought, we all know that the ACA has issues. It's by no means a perfect system. And many people in our group were firm advocates of a single-payer solution. And so they were concerned with, how can we promote that? And Massachusetts being probably more open to that kind of a solution in their state legislatures. Many people pursued going to the State House here in Massachusetts to promote a single-payer policy here in Massachusetts that could serve as a model that would work in other states.
Right. So you can hear in their organizing work, they knew that there was an immediate and urgent work in front of them, which was to stop the repeal of the Affordable Care Act. And ultimately, that was the solution that they chose, because when they looked at their goal criteria, it would help them build their membership. It would actually respond to the crisis in front of them. It would change the power dynamics by stopping something when even in Republican control, people could stop this bill from passing because of the lived impacts and lived realities. But at the same time, they had other solutions that would get to the ultimate goal of a country that actually cares for its people and has a health care system that works, right? And so state legislative action to actually build a model here in Massachusetts that could be seen across the country as the way it should be done was a potential solution. Another was engaging directly in other states to learn organizing tools and methods to make sure that they could win in the long term. Right? Those were other potential solutions that were offered. So we go through this to show this process. To set your vision, you have to understand the problem and context, and then you have to assess your potential solutions against goal criteria.